We're about to launch into our panel, and after the panel, there will be refreshments, so we want you to stay around. But more than anything, you'll find out why we want you to stay around in just a moment. I'm Belva Davis, a member of the San Francisco chapter of Links Incorporated, and a longtime reporter who's reported on the inequities of this community for more than 45 years. I'm sorry to say. There's always a new beginning, and we hope that we are at the, and with, the best seats in the House for a new beginning, at least so far as healthcare is concerned in this area. I'll be talking with Pete in just a moment. Peter Nix, of course, sitting right here, the producer, the director, the fundraiser, the heart, the passion of the waiting room. Pete, of course, is an award-winning producer in all of the many areas of media that one can produce in: cable, network, public, private, whatever it takes. That's what it takes to be a filmmaker in today's world, if you're doing independent and valuable work. So we thank you again. Tonight is about determining our own future. Now, like all of the star programs that insist upon we vote, even after the judges have spoken, those will be the rules tonight. But for you to vote, you have to agree in one way or the other that this is your party. This is the Bayview Hunters Point area's debut in terms of their advocacy for their own right to adequate health care. So if you now know what your party is in this movie we just cast, we'll get on great. As I said, you have to listen, and it's up to our esteemed panel, and it is an esteemed panel, for you to learn and then to act. All of these people, if we were just going to read their resumes, it would take up the entire time for our panel. So we're not going to do that. But I am going to start with a short conversation with the filmmaker and talk about the difficulties not only of conceiving and producing, but raising the money and then doing the promotion of an independent film at a time when the very issue that you've taken on is so highly political. Pete?
Wow. Well, first of all, thank you everyone for coming out today on a Saturday afternoon. The Giants must not be in town today. This is really what it's all about for this film, these community screenings. We just finished a national theatrical run that was quite successful, but these community screenings are really going to be the heart and soul of how we're going to make an impact with the film over the next several months leading up to our national broadcast in October 21st, where we'll have several million people watch the film, and that's going to be our biggest point of engagement. One of the observations of the film was from the Washington Post. I'm just going to throw this little ditty out really quick, and then we'll move on, which named it one of the top 10 films of the year after Lincoln and Zero Dark 30 was number 3. Very nice, right? That's nice. It was shortlisted for an Academy Award as well. Now, the Washington Post said if any film should be screened in the White House screening room this year, it should be The Waiting Room. So, of course, Barack Obama reads the Washington Post. I think Michelle does too. So I was just waiting for the call. So we've got it booked for you, the White House screening room. When are you coming? So I haven't gotten that call yet. So you all can help us, get that call by letting Washington know that this film deserves an audience in the White House screening room. We did screen on Capitol Hill several months ago, but we are going to be pushing to get this film screened in the White House screening room between now and October. So if you come, we have a Facebook page, join that, come to our website, join that, and you'll see how you can participate that way. It was a very long process trying to raise the money for this film. We had to raise roughly $1 million to shoot not just the film, but to create what is what preceded the film and is ongoing, which is a community storytelling project from the waiting room itself. And the basis of that project was the question, what are you waiting for? I mean, we didn't want to ask people, what do you think about Obamacare? What do you think about this hospital? We wanted to give people an opportunity to present their humanity in all its three dimensions at a time, a vital moment in sort of our national conversation around healthcare reform when these communities weren't being represented in that conversation. And so we created a storytelling project from the waiting room at Highland where people just could tell short stories about who they were that could scale out to waiting rooms all over the country. And so we're now that we've finished the film, we're going to turn our attention back to that digital storytelling project that we hope will be ongoing. But it was remarkably tough to raise the money for this film, and so you can only imagine what it's like for someone in a waiting room in a public hospital who relies on the safety net system to have to advocate for themselves. When I'm someone who has lots of contacts, skills. I went to graduate school. I've been making films for 10 years, and I can barely advocate for myself as an independent filmmaker to raise the money for these films. So it's a remarkable challenge for these communities to find ways and opportunities for showing and revealing why their lives matter and why their perspective matters. And so that's really why we made the film and why we're here today.
What I have to ask is the key question: how did you go about getting permission to do this? What did the city of Oakland officials say? What did the people say who you were filming?
Well, my wife works at Highland, so the film had a sort of long and winding road to come to me. It was a project that began with Rob Epstein and Jeffrey Friedman, who directed Times of Harvey Milk and Common Threads, which they won Academy Awards for those films. And so they're very well-regarded filmmakers. They knew a guy, Scott Burgess, who was on the board of directors at Highland, and that's how the initial access was gotten. But Rob and Jeff, funding for another one of their films came in early in the process. I had come on as a producer because I'd heard about the film and I know Jeffrey. My wife works at the hospital, and I've been wanting to make this film for many years, but I never approached the hospital because how do you get access to a large public institution where you want to go in and tell a story in such a way that's not necessarily going to make the hospital look great, and we ended up calling it the waiting room. And so there's a lot of, I think, hesitancy from the hospital administrators to open their doors to a filmmaking team. When I took over the project, my pitch to them was that, I have seen I've had a unique perspective from my wife just telling stories over the years of her patient population and of the challenge of the caregivers trying to provide care without enough resources, that I felt that there was an opportunity to tell a story that went beyond the typical story that you hear about Highland Hospital or SF General, any of these public hospitals, which is what you see at News at 11, and that we wanted to break open that really what is a kaleidoscope of humanity that manifests itself in the waiting room. The waiting room is really this remarkable stage for storytelling. And so I really convinced them that we wanted to tell a deeper, a richer story than healthcare really was being contextualized and put in a very political box, and we wanted to break outside of that framework. And we felt it was important to do that at this moment when the healthcare debate had become so political and so divisive that really what had been lost in that conversation was the humanity of the people who are showing up in these waiting rooms every day. So we got the access through that, and then that's at a high level with the CEO and the board of directors agreeing to let us in there, but then you have to get access all the way down to that person, that homeless person sitting in the waiting room, who we decided early on that we were going to treat them with as much dignity as we treated the CEO. And we took our cue from CJ, who's the triage nurse, who does the same thing.
Okay, we're going to now get to this panel
I could go on and
with
on.
The degrees after degrees.
I just want to let
the
you
real
know.
test for you is up here on this stage.